Hello, my name's Karen Harrison-Denning and I head up research and publications for a UK charity called Dementia UK. I've been a nurse for over 45 years now, but the majority of those years have been spent caring for families affected by dementia in a variety of contexts, care settings and services. More recently, and we're going back to 2008, I joined the charity and became a consultant Admiral Nurse. And it is today that I'm going to talk to you about Admiral Nursing. Admiral Nursing is based upon a model of case management. And case management is important when you support families affected by dementia because it offers the ability to navigate that person, that family's journey through the myriad of social, healthcare, private, voluntary sector interventions and services that a family might need to access over the trajectory of dementia. And sometimes that's not easy for families. Care and services differ from locality to locality. So case management is a way of enabling that family to access care and support that's specific to their needs. So the Admiral Nurse will undertake quite a comprehensive assessment to actually negotiate and work out what that family's needs are, not just the person with dementia, but the sometimes multiple carers that surround that family. Now, these might be family, they might be friends, they might be neighbours, but if we're to support that person with dementia well and to remain in their preferred place of care for as long as possible, it's important that we consider the needs of all of the people involved in that relationship. The interventions that an Admiral Nurse might use in these instances are many and varied and are very bespoke to the family with which they're caring for. So it might be involve advanced care planning, for example. So to actually elicit the views of the person with dementia, whilst they still have capacity, in actually enabling them to articulate what care they might want for the future. What care might they want at a time when they're no longer able to make or articulate those decisions themselves. Another example might be supporting them to manage other comorbid conditions. Again, dementia does not travel alone, and people with dementia often have a wide range of comorbid conditions. Often these are associated with age also, so they could be diabetes, it could be heart failure, it could be cancer. But when faced with dementia as well, in the mix with these comorbidities, it can sometimes confound the care that's delivered to families and to people with dementia. And actually engaging in treatment plans, for example, in cancer care, or making decisions about what might the best interventional course of action be. So they're just some of the examples of what the Admiral Nurse might support that family through. One of the other very important aspects to case management, and indeed the role of Admiral Nursing, is in supporting generalist practitioners to care for families with dementia equally as well. Not every person affected by dementia and their families requires an Admiral Nurse, but if an Admiral Nurse is within a health and social care community, they can support generalist practitioners such as GPs, district nurses, social care workers, to actually better support the families with dementia that they're caring for. When situations become much more complex, then an Admiral Nurse may indeed get involved and case manage that case. But that support for generalist practitioners can take many different shapes and forms. And Admiral Nurses are involved in education and training, for example. So they will support their generalist colleagues by training them and educating them about what are the specific needs of families affected by dementia. How can we better understand behaviours that a person with dementia present? What are the specific needs of carers of people with dementia? How do they differ from carers of other conditions, for example? But also importantly is in enabling those generalist practitioners to care better for the people with dementia on their caseload, we can actually support them by mentoring them through different aspects of dementia care. We can role model certain ways of managing behaviours, for example, and we can supervise them in their practice. So whilst we look at how we might support a family affected by dementia, we can also then include within that circle, within that network, how we can support generalist practitioners caring for a family with dementia too.